Hello and welcome into another Kettering Health Chats Live. I'm Dan Edwards, your moderator, I guess, if that's what you want to call me tonight. But this show, it's about you. This chat is about you. It's a live interactive forum where we want to take as many questions from you as we possibly can. And tonight's topic is cervical cancer. And we have a Kettering Health expert to answer your questions. And there she is. We're talking about cervical cancer, we're talking about treatments, we're talking about prevention, all that tonight with our doctor for the next 30 minutes. So right now, we want you to weigh in, get into that chat box and let us know, do you have any questions? Maybe about you, maybe about a family member, a friend who may have just gotten a diagnosis about cervical cancer. You can only do so much research online, right? Let's talk to a real doctor. We want to answer your questions. So again, type them in as we welcome Dr. Nicole Spady. Doctor, thank you so much for joining us tonight. We appreciate it.
Thank you.
Well, listen, let's just start, as people are kind of loading up with their questions in the chat box, let's get to know you here a little bit. One, it's great to have you with us. And two, what was your journey like? How did you make it to Kettering Health?
So I grew up in Indiana, and then I did my training out in California at Loma Linda University. And then I decided to come back to the Midwest.
And you also went to, you got your residency in obstetrics and gynecology, and also from the University School of Medicine in California in 2018.
Correct.
So you're kind of young, so that's good. You can answer these, maybe some of the younger ladies in the audience, their questions. That's probably a positive, isn't it?
Yes, I can definitely relate. It's nice coming straight out of a institution where you're at the cutting edge of research and technology.
Yeah, Loma Linda, they do some amazing things there. How was that experience in California coming from Indiana?
It was very different.
Yeah.
I didn't realize how much I missed winter, actually. So I've been enjoying the winter.
You missed winter.
I did. I'll probably get tired of it again. But
my son went to LA and he'll never come back. He does not miss winter. But we're glad you're here. And I understand that you're married to Pastor Austin Roberts.
Yes, he is part-time pastor, part-time chaplain with Kettering Health at Grandview Hospital.
Well, that has to be an interesting dinner time conversation when both of you are working at Kettering Health. I mean, let's be real. That job can be very emotional and very exhausting, I would imagine.
It can be. I'm actually post-call today, but it's good to have him as a support person.
So when you say post-call, it means that you've had a long 24 hours or 36 hours or whatever.
Yes, I have.
Leading up to this. So, all right. Well, thank you. Thank you so much for being with us tonight and joining us on this Facebook Live chat with Kettering Health, where we want questions from you right now. Get into that chat box and let us know on cervical cancer as our cyber patients are loading up, Dr. Spady. We're glad that you're with us. And I understand also that you're a pretty good cook.
I try. In my spare time, I like to bake everything from everyday meals to my favorite is cheesecake that my family likes on the holidays.
Okay. And you're going to be taking up gardening? Is that my understanding?
That's my goal now that I'm back in Ohio, but I'm going to wait for the springtime to get into that.
Well, good idea. Good idea. Well, all right. Kettering Health Chats Live as we await questions from you in the audience. Let's get to really what is cervical cancer, doctor. Let's just start right there.
Sure. So the cervix is the lower or inferior part of the uterus that extends into the vaginal canal. It is something that we can't see, so women are often asymptomatic. But it is a very preventable and easily screenable cancer.
So even self-examination is not going to really show anything, correct?
Correct. You're not going to see anything.
Yeah. How common is cervical cancer among American women?
It's very common. There's about 13,000 new cases diagnosed in the United States every year.
And you see your share, don't you, as far as you say your office is pretty busy?
Yes, unfortunately we do. It has gone down a lot since we have implemented the HPV vaccine and pap smears, but it's still much more prevalent than it should be.
Is it because you think that young adults are more sexually active now than they used to be?
It could be, although with condom use, safe sex practices, it is very preventable. And if you get the HPV vaccine prior to any exposure, then you're basically helping protect yourself from ever getting the virus that leads to cancer.
So you're saying it's 100% preventable?
There's not 100%, but the HPV virus causes the vast majority of cervical cancers, ranging from 95 to 98% of cervical cancers.
Okay, of those 13,000 are diagnosed each and every year with cervical cancer here in America. Who is the most at risk, do you think, that develops that?
So women who don't follow safe sex practices, if you are a smoker, you're at higher risk. There's certain ethnicities, Black women, Native American women have a higher risk of getting cervical cancer.
Why is that?
Probably poor health care. We don't know the exact reason. There may be a little bit of a genetic factor, but as long as you have access to good health care, you'll be able to prevent yourself from ever getting cervical cancer.
Okay. You know, of those 13,000, which is 13,000, way too many for sure,
Yes.
but how do those numbers compare to other forms of cancer?
In the United States, we have been able to decrease it below uterine cancer, way below breast cancer, but worldwide it is still one of the most common cancers.
Okay. Ashley Comer has just shared a question with us. She wants to know how, what are the symptoms or signs that you might have cervical cancer?
Yeah, I think we actually have a slide about this. Most often there's no symptoms, so that's why you want to get your routine screening. But sometimes you can have abnormal vaginal discharge. Occasionally you can have bleeding outside of your periods. So you always want to get that tested and go see your gynecologist if you're having those symptoms. Also any postmenopausal bleeding.
So cervical cancer is quite different than ovarian cancer then, obviously, right? With the rates of the mortality rates with ovarian cancer.
That's a really good point. Ovarian cancer is one of those cancers that we don't have any good screening modalities for it, and it's also asymptomatic though. But since we don't have ways to prevent it and screen for it, it's often detected in late stages. Versus cervical cancer, we can detect precancerous cells on the cervix before it turns into cancer and then prevent even getting cancer.
Okay. Does family history play a role in this at all? You mentioned some of the ethnic groups that because of poor health care, but does family history play into this at all?
It can. So if you have a family history, you should definitely get screening. But a lot of women are diagnosed and they're the first ones in their family. So regardless of your family history, you want to get routine screening.
Well, let's talk a little bit more about Pap smears. I mean, how often do we get those? Is it a once a year thing, or what's your suggestion?
So if everything is normal, you want to start age 21. And then you get it every 3 years until age 30, where it goes to every 5 years. This is if everything has turned back normal. If you have abnormal results, then they may recommend more frequent screening, sometimes every 6 months, sometimes once a year.
Okay. So Pap smears are critical in early detection, and I'm assuming that early detection, if at least with cervical cancer, if you can find this early, you've got a really good chance of getting a clean bill of health, don't you?
Yes. So Pap smears, they're pretty easy to obtain. Some women have some anxiety about going to their gynecologist and getting it done, but vast majority of my patients, when they get their Pap smear done, they're like, oh, this is so much easier than I thought, so much quicker than I thought.
Oh, good.
And so just build up the courage, go see your gynecologist, especially once you reach age 21, and then through on your life, it'll just become a habit. And with the Pap smear, we can detect precancerous cells from certain levels. If you have very benign lesion, then they may not recommend doing anything at that point. If it's a higher abnormal cell, then they may recommend that we do something called a colposcopy. That's where we use a device called a colposcope. It's basically a large microscope where we look at the cervix and we can see if there's any abnormal cells in the cervix that need biopsying.
Can you see that almost immediately, or does it take time over time to develop?
Cervical cancer, it takes about 10 years to turn from precancerous cells into cancer. So you have some time to go get your screening and get detection, and that way you can have minimal intervention from a small biopsy to a small frozen procedure to sometimes a larger procedure where we kind of remove the top cells of your cervix and prevent those from turning into cancer.
Autumn writes in with a question, a very interesting question. If you don't have periods, what might be some of the other symptoms you would be looking for? Probably wouldn't be a whole lot with her.
You know, you could have some abnormal discharge, sometimes like gray, milky discharge. But if you're not having periods, you might want to see your gynecologist as well. If you're on birth control or something that's causing you to not have periods, that's okay. But otherwise, if you're not having periods, that's another reason you should definitely see your gynecologist and get that evaluated.
Right. Guys, I hate to ask this question, but I think it's important. How deadly is cervical cancer if it goes undetected?
So if you don't get your pap smears and it goes undetected and it's detected at an earlier stage, there's still a high survival rate. It's about 92% if detected early on. Later stages, it goes down to about 18 to 44% survival rate.
All right, so 92% if you can catch it.
I mean, most people will catch it even before it turns into cancer with their pap smears. So it's much higher. It's preventable if you get your pap smears.
I mean, just a routine gynecological visit, you're checking for this automatically, I would assume, correct?
Yes.
Yeah.
You should see your gynecologist about once a year, and we'll be following up on your pap smears every time and making sure that you are good of your screening, or if you need to get a pap smear that visit.
Ashley has a question about, what happens if you haven't had one since you were 22 years old. I mean, that's quite unusual, I would imagine.
It happens. A lot of women get busy and they put their families first, and sometimes they don't get to the gynecologist for their own health, but just go see your gynecologist and they can get a pap smear. Even your family doctors can do pap smears as well.
Okay. What, when cervical cancer is discovered, I mean, what's the procedure? Kind of walk us through what happens with that patient and the timeline and type.
Sure. So if it's still kind of that precancerous stage and you need a more invasive procedure, we can do what's called a loop procedure or a cold knife cone procedure. This can sometimes be done in the office, or we can do it in the operating room where you're asleep. And with that, we either use for the loop, we use a loop of hot wire that kind of shaves off the top of your cervix, or we can use a scalpel and just take a little cone biopsy of the cervix and remove the most superficial portion of the cervix, and that can completely remove the cells sometimes. Often after that, if there's clear margins, then we'll just do routine pap smears every 6 months and then maybe once a year, and then we'll slowly get you back to routine screening after that. And a lot of times, this is all we have to do, and you don't have to have a hysterectomy or chemotherapy or radiation. This will prevent it from spreading to that point. If it is detected at a later stage, then we would recommend seeing a gynecologic oncologist. There's specialists in gynecological cancer, and then they can talk to you about treatment of radiation, chemotherapy, or hysterectomy if need be.
So, as a doctor, I mean, you're skilled at what you do, but how difficult is it for you for the treatment process of this if it does get into the surgical realm?
It's very easy for us.
Okay.
We're trained in this, but it hurts when it goes this far. Like it always hurts me to know that if they had just come in for earlier screening, we could have detected this earlier and wouldn't have to be putting them through this.
Mm-hmm. Laura comments in the chat box, I remember having to get pap smears yearly. Should you still have a yearly exam with your OB-GYN?
So you can definitely talk to your OB-GYN if you need to do that. Most OB-GYNs and ACOG, the American College of Obstetrics and Gynecology, go by the ASCCP guidelines, or the American Society of Cervical Cancer Prevention, and they're the ones who come up with the guidelines based on your risk. So we have algorithms where we'll put in your age, whether you've ever had an abnormal pap smear, whether you've ever tested positive for the HPV virus, what your previous results were, and then from that determine how often you need your pap smears.
So share with me exactly what HPV virus is, or HPV virus is, for our listeners who may not know.
So the HPV virus has several different strains. Some of them cause genital warts, some of them cause cervical cancer. And there's actually a vaccine, the Gardasil vaccine, that can protect you from the most common types. You can get it anywhere from ages 9 to ages 45. Mm-hmm. Average recommended age is 11 to 12, because you want to get the vaccine before you're exposed to the virus. So this is the decision that parents will often make to whether their kids will get the HPV vaccine. So some adults don't even know if they've had the vaccine. So I always recommend, if they're not sure, check their vaccine list and see whether they got it as a child or not. And if they didn't, definitely get it as soon as you can. It's a 3-dose course when you're an adult. You get the first dose, and then the second dose is 2 months after, and the third dose is 6 months after that.
Mm-hmm. Well, you're fairly new to the community. I mean, like Ashley has a question like, what if you need help finding a good OB-GYN? I know we have Kettering Health has a good network.
Yeah, Kettering Health definitely has a search engine where you can search for a family medicine doctor or an OB-GYN that you can get plugged in with. I'm at Advanced Women's Healthcare at Soin Hospital, but you can just Google, I know there's Premier Health in the area, Miami Valley, and find a good provider that you trust.
Okay, super. When you're dealing with this, is there much pain involved?
Often when you don't even know that you have abnormal cells, it's pretty asymptomatic. Obviously with the later stages it can become very painful. But the pap smear itself and the treatments, they often are pretty mild pain and discomfort, just the same as you would have with a routine pelvic exam.
Okay. Let's now talk about being responsible, lifestyle changes. We know smoking is bad no matter what, so we hope you're not smoking, and if you do, please quit. And to those who are smoking, just know that you can do it, and there's a good reason, many good reasons to do that. And for those of you trying to help those quit smoke, be supportive, okay? Because it's not easy. I used to be a smoker many years ago, and I always appreciate those who congratulate me for quitting smoking, because it's a big milestone, and it's an important health marker too. So other than smoking, doctor, what's some of the lifestyle changes that maybe we can incorporate to prevent this from happening?
Yeah, smoking is a big one because it'll sometimes prevent you from clearing the HPV virus and let those cells progress. But getting your HPV vaccine is probably the biggest thing you can do to help prevent getting cervical cancer. And then the other one is practice safe sex and use condoms.
All right. You see a lot of patients, doctor. Is there a reason that women give you that they don't come in to get their checkups that maybe persists over others?
Yeah, I think a lot of women, since you can't see your cervix, you just kind of forget about it and keep putting it off. You think, oh, it's not going to be me. There's discomfort with the exam, and so it's just pretty easy to put off. And then, like I said, a lot of women put their families first, which is very important, but you also need to take care of yourself so you can be there for your family. So making the time to go see your doctor is very important.
Yeah. Because of the pandemic, are you seeing kind of like a backlog of women trying to catch up with their health?
Yeah, so there has been a concern that since the pandemic, especially when they were not even scheduling well woman exams, that there was going to be an increase in cervical cancer rates.
Right, that's what I think.
And unfortunately, since cervical cancer takes several years to develop, we don't have the data on that yet. But since women weren't going to the doctor and we didn't have the capacity to even schedule some of these exams, that was a concern. But now that we have availability, you're able to go get testing, now is the time.
Okay. Again, back to maybe some preventable techniques. Is diet, exercise, environment, any of those have any impact on the rise of cervical cancer?
Yeah, no physician is going to tell you that diet and exercise don't play a part in your health. Diet and exercise is always the right.
Always good, right?
Is always the right answer. Yeah. This cancer, not as much as some of the others, but always optimizing your health will help you.
You know, we talked about the emotional aspect of this. When someone is told you have any type of cancer, regardless, it's just one of those moments in your life where the world just stops spinning. I know Kettering Health has counseling services available for such matters to kind of walk you through or hold your hand through this process.
Yes, they do. It's a very important part of taking care of the patient to also discuss and pay attention to the mental health side of it.
Yeah. And to have a support group too. To go through it with other people who are going through it, I think that's a critical component.
Yes.
Yeah.
This cancer too, most common diagnosis is age 35 to 45. So it's a younger diagnosis as well. So it's often just adds even more heartbreak.
Yeah. Are the numbers going up or staying about the same or going down?
They're going down thanks to more discussion about the HPV vaccine and safe sex practices. So it's one of those cancers that we've been actually able to decrease. We should be decreasing even more, and hopefully we'll get to that point. But it's one of those diseases that we can almost eradicate due to pap smears and the HPV vaccine.
But you got to come in. You got to get checked
you have
before
to
you
do
know
your part.
it. So,
Yeah.
guys, go in. Call the action, right? Get on in there. You're nice people. They'll take good care of you. And I mean this. My wife works with Kettering Health, and I have just been amazed by this organization from just about, every level that I have seen. That it's such a caring, compassionate, mission-driven organization I didn't think existed in this world, but it's right here in our region, and it's in our back door, and they have good quality doctors like you, fresh out of Loma Linda, who are bringing the latest to their patients. I think is critically important to the overall health and well-being of our region.
Yeah. It's something that I'm so happy that I joined the mission of Kettering, and I'm here. And doing talks like this, we're reaching out to the community and trying to educate the community so that they can empower themselves to take care of their health.
Doctor, you see we've been getting some floating hearts during the chat. This is fantastic. One more question, I think we have time, from Cynthia. How long has the HPV vaccine been around? That's a good question.
That is a good question, which I don't have the answer to, unfortunately.
Didn't teach you that, Loma Linda.
It's been around for a while, though.
Right.
It's been through more recent years, though, that they extended it to age 45. So that was a big help when they did the research and found that you can get it up to age 45, because it used to be very limited to just pediatricians talking to parents about getting it. And that often wasn't on the parents' mind at that time because their child was young and it was far away from ever being exposed to the HPV virus or getting cancer. So a lot of kids didn't get it when they were young. But now that it's able for adults to get, it kind of brings the responsibility on you, and you can go get it for yourself, which is really great.
Why did it get into the adult world like that? Does that surprise you?
Sorry, what's the question?
How it got into the older ages of women as opposed to the younger teens?
Yeah, more research came out, and the CDC, I want to say about 4 years ago or so. I could have that wrong, but they extended it up to age 45 for men and women. Appreciate
it. So, I mean, once a woman goes through, it goes into surgery. Afterwards, is there much pain? What's the process like? The recovery life like?
From a cold knife cone procedure or a LEAP procedure, it's pretty minor, probably about You go home the same day, a few days of discomfort, up to about 2 weeks of kind of healing back to your normal self, but it's pretty minor. Obviously, if you have to have a more larger procedure like a hysterectomy or
Right.
need to go through chemo radiation, that is
Yeah.
a much longer process that we want to prevent you getting to that point.
Okay, well, I know our focus is on cervical cancer, but can you touch upon maybe some of the latest technologies that Kettering Health has in the hysterectomy?
Yeah.
This is-
So one of the big things is doing robotic hysterectomies. That's come out in the last several years, which really improves patient satisfaction. You go home the same day, even after, though it's a major surgery. Pain is very minimal. Some patients are talking about, they come back and tell me that they're walking around the next
Really?
day and going about their normal lives. And I try to tell them to slow down a
Chill
little
out,
bit and make sure they're taking care of their bodies during the recovery process. But it's a wonderful thing that we have to offer to patients. There's different forms of hysterectomy, from vaginal, open if we need to, versus laparoscopic, and then robotic.
Right.
But it's so amazing that we have that here at Kettering
gosh,
and are
yeah.
able to offer it to our patients.
Yeah, we have world-class facilities here in the Dayton region that are just phenomenal. Doctor, maybe you touched upon this already, but what is the earliest age that a young girl should come in for a pap smear? Was it 6?
Age 21.
Oh, the earliest?
Yes, for a pap smear, just because
okay.
it takes a while to turn into cervical cancer.
Gotcha, okay.
And even though you may be positive for the HPV virus beforehand, a lot of women will end up
21,
clearing it.
okay.
So we don't recommend pap smears till age 21.
Gotcha. Okay, I need to pay attention.
Yeah.
Sorry about that.
It's okay. It's recommended to see your gynecologist before that. You can talk to them when you're an adolescent. That way you can kind of establish a relationship with them. And you don't have to dive right into doing a pelvic exam and pap smear the first time you meet your gynecologist.
All right, I think we have time for one more question here. Are you most likely to be at risk of cervical cancer before or after menopause? Good question.
Usually before.
Okay.
The most common age of diagnosis is in your 30s to 40s, so it's a young person's disease.
Okay.
And you're often exposed to it in your teenagers when you're exposed to the HPV virus.
Gotcha.
So you want to get that detection early on.
Dr. Spady, go ahead, I'm sorry.
Oh, I was just going to say, it still can happen after menopause, so you still want to
Okay.
get your screening then, but you want to get it throughout your whole life.
Gotcha. Man, some really good information, Dr. Spady. Thank you.
Thank you.
Fantastic. We appreciate your time and expertise and your obvious passion for what you do with Kettering Health, and we're lucky to have you in the Dayton region. Thank you for being here with us and choosing Dayton for you to put out your shingle, so to speak.
My pleasure.
Good. All right, so if you'd like more information, just go to our websites that we have up. There you go. I don't have to say all that, but that's where you can go. Give you a little time to see that, ketteringhealth.com/services/women's-health, okay? And we appreciate it. Look for updates right here on Facebook. Our next Kettering Health Chats Live is going to come up February 28th. And guess what we're talking about in February? Yes, heart health. Oh, it makes sense. It's Valentine's month, right? Except we're going to be talking about a different broken heart with our next Kettering Health expert, so we look forward to that. Well, I'm Dan Edwards. We will see you again in February. Doctor, thank you for being with us once again, and thank you for being a part of our Kettering Health Chats Live. It's Kettering Health. We want you to be your best.